Hi, Dr. Peter Coleman. I'm a board-certified addiction medicine specialist who's retired, and I had 40 years experience working and helping patients with opioid use disorder. Today we're talking about the third reason why opioid use disorder is worse in many ways and very dangerous and difficult for patients to recover from, and why they have to take their disease incredibly seriously. They have to probably work harder than people who have an alcohol or a cocaine or other problem. And that's because without medications for opioid use disorder, what we call MOUDs, or used to be called MATs, the recovery rates are incredibly low. We've known that for a long time. One of the first treatment programs was called the FARM. I think it was in Kentucky, and they had people staying there for a whole year. And they found that almost everybody relapsed as soon as they left the program. I noticed it when I was running an outpatient treatment program. We have an intensive outpatient program back in the 90s. And we started looking at our results, and we were treating alcohol patients and opioid patients. And when we looked at our alcohol patients, we had a 60% success rate after 3 months, and we were happy with that. When we looked at our opioid use, we had zero success. Not one person had even finished the intensive outpatient program, let alone stayed clean and sober. And there was a Seattle study I saw years ago where they put like 126 people into an inpatient detox program and then referred all of them for treatment. And after 3 months, only 4 of them were still opioid free. So that's how difficult it is to recover from opioids if you don't get on to one of the medication treatments. It's very, very difficult. This was particularly a problem about 15, 20 years ago because most hospitals were still detoxing people completely off all drugs and then keeping them for 28 days and then discharging them, only to find that many of their patients relapsed very quickly. And unfortunately, a number of them died because of their low tolerance when they did relapse. So most hospitals now put people on one of the medications for opioid use disorder, or they put them in long-term rehab or halfway houses or other things that are going to allow them longer periods of time for their brain to heal and to learn what they need to for recovery. There's a number of reasons why the success rate for opioid use disorder is so low. I think one of them is that the post-acute withdrawal just really takes a long time. So any time that your brain hasn't completely gone back to normal, it hasn't fully healed, you're vulnerable because you'll have some cravings and you'll be vulnerable to relapse. Secondly, I think the memory and emotional triggers that are associated with opioid use disorder are stronger and more powerful than many of the others. So people get triggered more easily and they have cravings and they're more likely to relapse because of that. Thirdly, opioids, as I mentioned in another video, are very strong painkillers. They work on the opioid receptors, the endorphin receptors in the brain. And they provide enormous amounts of pain relief, both physical and psychological. As I said previously, someone said it's like getting a hug from God. Even Homer, the poet from about 700 BC in ancient Greece, he wrote that opium is the drug that lulls all sorrows. So even 2,600 years ago, they knew that opium relieved pain incredibly well. Opioids also give a huge energy boost, and that feels really good. Most of us feel tired quite a bit of the time, and getting some extra energy by taking some opioids and going back to it is awfully tempting. And lastly, they're easy to get. We had a patient who came back for a follow-up treatment in West Virginia, and he was working in the coal mines there, and he came back and he'd been clean and sober for 8 months, and he came in and said he was feeling so good, and he actually said he'd just been able to buy a present for his daughter for her birthday for the first time in a number of years. So it was very touching. But then he said something that was amazing. He said, when I drive home from the coal mines to my house, he said, I counted up the other day how many places I could stop and buy some oxys. 21. He said 21 different places I could stop. Each one of those is a trigger. Each one of those is a potential relapse. That's how easy it is to go back to using the drugs. So the bottom line is opioid use disorder is serious, it needs to be taken extremely seriously. People need to work really hard at their program.